Hi.
Hey, my name's Missy.
And I'm Michael. We're going to talk to you about Alzheimer's and the things that cause it and some ways to even treat it or prevent it.
Okay, so I'm going to start going over the traditional pathophysiology of Alzheimer's. Most of my information I got off Up to Date. So Up to Date explains that the brain is dependent on healthy neurons to communicate through electrical and chemical signals. These neurons form synapses where neurotransmitters, especially glutamate and acetylcholine, allow information to pass between your cells. Normal brain function is dependent on adequate cerebral blood flow and efficient metabolism of glucose and the removal of all abnormal proteins from the brain. And under normal conditions with the brain, proteins, um, amyloid precursor protein, which is APP, and tau help with normal growth and repair and stabilize the neurons. Um, so, in Alzheimer's disease, Alzheimer's is a progressive neurodegenerative disorder, and it's also the most common cause for dementia. But the disease develops over the course of many years, usually before the symptoms are even present. And the following like hallmark pathological findings for Alzheimer's are extracellular accumulation of amyloid beta plaques, and intracellular neurofibrily tangles from hydrophosphorylated tau proteins. So these peptides form into extracellular plaques that disrupt the communication in the synapse, and they also cause like chronic neural inflammation. Um, and then while that's going on, tau proteins become hyperphosphorylated and detach from the microtubules in the neurons and form these tangles that disrupt intracellular transport and eventually lead to your neurons dying within the brain. And then as these neurons die, there's widespread loss of synapses, and there is also cerebral atrophy, um, usually in the hippocampus, and then later in the temporal and parietal and frontal lobes. And changes in these structures can lead to progressive loss of memory, function, language, and eventually the ability to like perform daily living. Um, let's see. Current evidence has shown that other factors like vascular disease, mitochondrial dysfunction, oxidative stress, and chronic neuroinflammation also contribute to significant progression and development of Alzheimer's. Um, so some non-modifiable risk factors for developing Alzheimer's are advanced age, which is the biggest risk factor, being female, family history of Alzheimer's, um, APOE, uh,
Which we'll talk
well,
about later.
yes, it's tied in there. Having Down syndrome, and then there are mutations in different genes, APP, PSNE1, PSNE2, that can put you more at risk for developing Alzheimer's later on. And then some of the modifiable risk factors for developing this disease are hypertension, type 2 diabetes, hyperlipidemia, obesity, smoking, physical inactivity, lower education levels, social isolation, TBIs, increased alcohol intake, poor sleep quality, and cerebrovascular disease. And a lot of the modifiable risk factors are contributed to like vascular disease, chronic inflammation, oxidative stress, and like impaired amyloid clearance, which I found really interesting. Um, Early manifestations of Alzheimer's are the short term memory loss. They have a hard time remembering new information, um, kind of misplace things, have a hard time finding words, um, can't concentrate as well. And then as the disease progresses, they develop aphasia, so language impairment, apraxia, hard time doing tasks that they normally have an easy time with, um, and then a hard time remembering and recognizing family members or familiar things. um, impaired judgment. You start having behavioral changes, personality changes. They get depressed, anxiety. Um, and then late stages, they experience cognitive impairment. They lose the ability to verbally communicate, dysphagia, bowel bladder incontinence, and then have loss of independence with ADLs. They need help with all that stuff, immobility, and then they're at an increased risk for developing infections, especially pneumonia. That's the highest mortality rate in Alzheimer's patients is pneumonia. So when you're diagnosing these patients, you want to do a clinical assessment. You want a comprehensive H&P from both the patient and their caregivers. Complete physical and neural exams. You want to do cognitive testing, so the MoCA, MMSE or mini cog assessment, just to kind of track the disease progression, and then kind of assess how they're able to function with their EDLs, how much they can do for themselves. You can do labs mostly just to rule out any like reversible causes of cognitive decline. So you want to check CBC, CMP, vitamin B12, and TSH. And then you're going to do some neuroimaging. MRI is preferred, but CT can be done too to look for any cerebral atrophy. And you want to rule out like stroke or tumors or anything like that. Um, and then some biomarkers that can be done in select patients. Amyloid PET scan, tau PET scan. Um, you can do CSF biomarkers. So they would have decreased A beta 42, increased phosphorylated tau, or increased total tau levels. As the disease progresses, usually kind of over 8 to 12 years after the diagnosis is when they really start to decline. Um, so in the preclinical stage, they're usually asymptomatic. Their amyloid and tau pathology could be elevated in their biomarkers. Mild, they're going to have a little bit of cognitive impairment, and then they're usually going to be completely independent still. And then you get into the mild dementia, they're going to become more forgetful. They might have a hard time managing their meds or finances or complicated tasks. And then you get into the moderate dementia, they will have significant memory loss, behavioral symptoms. They're going to need more help with daily living activities. And then you get into the severe stages where they are completely dependent on their caregivers. They don't really have much verbal communication. They have a hard time swallowing. They're more immobile. And then you have that higher risk of infection and death. And the progression of Alzheimer's is really caused by that continual neuron death and synapse dysfunction. And then you have the widespread cerebral atrophy. There's not a cure, but some like medications can be used to help modify the disease, like lecanemab and donanemab, and they can kind of help slow the progression in some patients, but not all.
All right, when we look at what drives Alzheimer's, we have to look at both the genes we inherit and the world we live in. Genetics are a major factor, accounting for 56 to 80% of the overall risk. For about 1% of cases, the disease is early onset and autosomal dominant, caused by mutations in the three specific genes we talked about, mentioned already, the APP, PSEN1, and PSEN2. We see this clearly in individuals with Down syndrome who carry an extra copy of the APP gene and almost always develop Alzheimer's by age 40. But for the other 99% of us, the genetic story is different. The biggest player here is the APOE epsilon 4 gene. Carrying one copy increases your risk of Alzheimer's fourfold, and two copies raises it 15-fold, with a lifetime risk exceeding 50% by age 85. Interestingly, this gene even influences how much our diet affects our brain health. Beyond APOE, researchers have identified over 100 other genes that contribute minutely on their own, but together create a polygenic risk score that can predict future disease with up to 85% accuracy. But genes aren't destiny. The 2024 Lancet Dementia Commission showed that environmental and lifestyle factors account for nearly 45% of modifiable dementia risk. Air pollution alone accounts for 3% of that, with fine particulate matter from agriculture and wildfires having the strongest ties to the disease. So we might be a little screwed here in Utah with all this smoke we keep getting down through the valleys and whatnot. Toxins like lead, cadmium, and aluminum, as well as arsenic in our water, can have an effect, as well as chronic noise exposure and traumatic brain injuries, also significantly driving up the risk. Furthermore, we know now that gut health plays a major role through the gut-brain axis. Patients consistently show less diverse, more pro-inflammatory gut microbiome, even in the early stages of mild cognitive impairment. This means that there's not enough of the good bacteria and there's too much of the bad bacteria. If there's one tool we have that is highly modifiable for almost everyone, regardless of social determinants, it's physical activity. Regular exercise can slash your Alzheimer's risk by 14 to 26%, with the sweet spot being about 3 to 6 hours a week of moderate activity. Conversely, prolonged sitting, meaning 10 hours or more a day, significantly spikes dementia risk. But the types of sitting also matter, because cognitively passive sitting, like watching TV, is incredibly harmful. But cognitive active sitting, like reading or using a computer, can actually be protective. A major JAMA study of nearly 50,000 people found that dementia risk spikes dramatically once you cross that 10-hour day sedentary mark. Because the average American sits for 9.5 hours a day, we're right on the edge of this risk zone. Crucially, this risk remains high even if you work out, but still sit all day, proving that being sedentary is an independent risk factor. So if you got to sit for, or if your job is sitting, get up and move frequently. The good news, physical activity is protective regardless of your genetic risk. Aerobic movement has the strongest evidence for boosting brain power, requiring about a 150-minute a week of moderate intensity exercise like brisk walking. However, combining aerobic exercise with strength training has been shown to be the single most effective strategy for preserving cognitive function. Two other massive pillars of prevention are stress management and sleep. Chronic stress increases your dementia risk by 44%, and experiencing two or more major life stressors jumps that risk by 72%. Stress floods the body with cortisol, which directly accelerates the buildup of amyloid beta plaques and tau tangles that we talked about, while damaging the blood-brain barrier. With sleep, the relationship is bidirectional. Poor sleep drives the pathology, and the pathology ruins sleep. During deep sleep, a brain-wide cleaning network called the glymphatic system turns on to flush out toxic proteins the way a dishwasher cleans your dishes. If sleep is disrupted, this cleaning process fails. The data show a U-shaped curve here. Both too little and too much sleep can both increase risk, making 7 hours about the sweet spot. But we can't talk about these risks without acknowledging social determinants of health. Facing cumulative social disadvantages can increase your risk of dementia by up to ninefold. Of these social factors, education, also talked about earlier, is the strongest predictor. Having less than a high school education carries a 2.64-fold increased risk of dementia. Education builds cognitive reserve, the brain's capacity to improvise and find alternative neural pathways to bypass damage. High cognitive reserve reduces dementia risk by 47%. It doesn't stop the physical plaques from forming. Instead, it makes the brain's existing network more efficient. Unfortunately, lower socioeconomic status also clusters other risks together, making people in poor neighborhoods statistically more likely to experience trauma, chronic stress, sleep disruptions, and environmental pollutants. So, knowing all this, what can we actually do about it? If we want to build a shield against Alzheimer's, we have to focus on highly accessible daily habits. First, move your body. We want to aim for at least 150 minutes of moderate exercise per week. Think of it as a brisk 30-minute walk 5 days a week. It stimulates cerebral blood flow and triggers the release of BDNF, which is essentially fertilizer for your brain cells. The famous Exert and US Pointer trials proved that structured exercise can actually preserve cognitive function and physically grow the hippocampus, effectively reversing 1 to 2 years of brain shrinkage, which is crazy. Second, protect your sleep. We need to strive for 7 hours of uninterrupted sleep to let that lymphatic dishwasher do its job. You can drastically improve your sleep hygiene with a few simple tweaks. Banish screens for at least an hour before bed. Keep caffeine strictly to the morning so it doesn't ruin your sleep quality. Make your bedroom as dark and as quiet as possible. Third, never stop learning. Read books, listen to podcasts, pick up a new instrument, or try a new hobby. Even if it's just, you only have time to do just a little bit at a time. This active mental engagement builds that crucial cognitive reserve. Think of it like this: the sharper the knife of your mind, the longer it takes to dull. By constantly building new neural detours, your brain can continue to function beautifully, even if some pathways suffer wear and tear over time. Finally, focus on dietary improvements. You don't need a perfect, restrictive diet to make a difference. Even small shifts yield big results. Studies show the Mediterranean diet can cut risk by 4 to 9%, and general dietary improvements over a decade can slash risk by up to 25%. Start by limiting highly processed foods and added sugars, which fuel brain inflammation. At the same time, pack your plate with vegetables and whole grains. Increasing your fiber intake keeps your gut microbiome happy, which directly dampens the inflammatory processes throughout your entire body. By combining physical movement, quality sleep, continuous learning, and gut-friendly diet, we aren't just fighting off a disease, we're actively building a more resilient, high-performing brain for life.
Okay, so some lifestyle interventions that can be implemented for patients that have Alzheimer's, or even before you have Alzheimer's, especially things you can do as a nurse practitioner. Um, Partnering with with your patients with Alzheimer's really requires you to have a collaborative, like patient family centered approach, because as the disease progresses, their caregivers are going to be more involved and more reliable in like their history and everything. Because these patients' cognitive impairment process over time declines, successful lifestyle modifications usually involve both patient and caregiver. And the goal is to preserve the patient's independence for as long as possible while also promoting overall health and their quality of life. Evidence has shown the lifestyle interventions, like including regular physical activity, following a Mediterranean diet, and cognitive stimulation and social engagement, and also managing your cardiovascular risk factors and ensuring adequate sleep, has shown to slow cognitive decline and improve patients' overall function. Um, One thing as a nurse practitioner that you can do when these patients come in is called motivational interviewing. It's an evidence based communication strategy that really encourages your patient to identify what motivates them to change their lifestyle rather than just, oh, my doctor said I need to do these things different. Um, in individuals with early Alzheimer's disease, this can improve patient engagement in their care by kind of having them explore what their values and goals and concerns are while they are able to maintain their autonomy. So some questions you can ask are: what activities are more important for you to keep doing? Or what concerns you most about your memory? And this helps the patient express personal priorities and concerns that they have, um, and as cognition declines. Motivational interviewing should often involve more of their caregiver. You still want to include the patient as much as you can in the conversation, but they might not be able to be as involved. This helps with therapeutic relationships and helps improve um, the patient sticking with these recommended lifestyle changes. Um, Shared decision making is really important in patients with Alzheimer's because their treatment decisions usually involve a balance of risk, benefits, patient preference, and caregiver responsibilities. So you really want to include caregiver and the patient as much as you can. You should provide clear information that regards lifestyle interventions, medication options, safety concerns, and long-term planning. Um, by encouraging both the patient and family members to participate. So some things you could go over would be like deciding how they should begin a structured exercise program or choosing dietary modifications that work for their family or um, discussing like advanced care planning early on in the Alzheimer's stage so the patient can be involved in that. Helps the patient feel like they're included in their care and making health decisions for themselves and also including their family in the care and making sure it works for them. Um, Smart goal setting, which are specific, measurable, achievable, relevant, and time bound goals, should be set for your patient. Alzheimer's can really impair their executive function, so these goals should be simple and achievable for the patient so they don't become frustrated. So things like walking for 20 minutes with their caregiver several times a week for a month, or eat one Mediterranean style meal 5 days a week, or participate in one cognitive activity like a crossword puzzle or reading, or music therapy for 20 minutes every day, or go to one social activity a week. Would really help these patients be able to reach small goals, helps them feel more confident and feel less frustrated, and also helps with burden on their caregivers. Um, Identifying barriers to change. Some barriers in Alzheimer's disease patients include their progressive memory impairment, anxiety, depression, financial limitations, caregiver stress. They have limited social support, uh, mobility limitations, and then multiple chronic medical conditions. As they cognitively decline, they can also have reduction in their ability to remember appointments, meds, to exercise, and it can really put a lot on their caregivers. Um, so some interventions you could use calendars, smartphone alerts, referring patients to occupational therapy to help them remain as independent as possible, connecting their caregivers with Alzheimer's supports groups, arranging home health, screening and treating them for depression or sleep disorders, and then providing written instructions to these patients using a large print and simple instructions so they can follow them. Um, so these patients require continuous monitoring, especially as the disease progresses, and not just episodic here and there care. Their follow-up visits should be about every 3 to 6 months, depending on how severe their Alzheimer's is. And you're going to want to reassess cognition, functional status, if their medications are effective, how their nutrition and exercise are going, any safety concerns, and you're really going to want to hit on their caregiver and how they're doing because caregivers can really struggle with this caring for a family member with Alzheimer's. Um, and then you would just want to stick with either your MOCA mini, um, your MMSE, or the mini cog exam just to kind of track how their cognition's declining. It gives you a baseline. Long-term support, you want to include interdisciplinary care with like neuro, physical therapy, occupational therapy, speech therapy, nutrition, social worker if you need to. You want to also continue educating the patient caregiver about managing any like behavioral symptoms or keeping the home safe for the patient, or if you need to take away the patient's keys when they can no longer drive, or um, setting up an advance directive or any community resources that might be available for them. And then you just want to keep educating um, and assessing their emotional stress and provide support to the patient and the caregiver throughout the whole process of this disease. And ultimately, lifestyle changes in Alzheimer's are achieved through continuing collaboration between providers, patients, and caregivers, and combining motivational interviewing, shared decision making, and the SMART goals. Their assessment and ongoing follow ups helps promote patient centered care and maximize their independence and quality of life throughout the progression of their disease.
Well, understanding everything that goes into contributing to Alzheimer's, it it's really helped me realize how much we can change um, and teach patients um, how to make a difference in either to slow the decline or in some cases reverse it. Especially with like the gut. We've been learning so much about how important the gut is and keeping it healthy to change the severity of chronic disease and in some cases eliminate it. It plays a big role in Alzheimer's even. So for me, understanding the root causes of Alzheimer's is going to help me as a nurse practitioner suggest these little things using interviewing for sure. Came across that research in another project of mine, but to use motivational interviewing so the patient is able to describe what will be easiest to change for them, and I, as a practitioner, will be able to make suggestions that will work best for them to help them manage that cognitive decline with Alzheimer's and slow it down significantly.
I just thought it was really interesting how big of a difference your lifestyle changes can make in these chronic diseases that
Mhm.
were always kind of like viewed as like they just happen, you're old, it's just a thing that happens,
It's inevitable.
Like,
You're doomed.
yeah. So just like as a nurse practitioner, I've kind of like in my clinicals and everything, a lot of the nurse practitioners I followed have really hit hard on lifestyle changes. And even if you still need to do some medications here and there, even like they're still big on the lifestyle changes and how big of a difference that can make. And then as we've gone through this course and realizing like how preventative that can be, or how it can really help reverse like your potential for developing these diseases or anything like that, has really been interesting to me. And I'm like, that's something I can try to implement in my practice as a nurse practitioner and really focus on to try to help patients be healthier.
That's so good. All right. Thanks everybody for listening.
Thanks.